Hello, I'm Harvey Godwin Jr., Chairman of the Lumbee Tribe, and today I'm at Pembroke Family Practice here in Pembroke with one of my favorite doctors, Dr. Chamaine Locklear. And Dr. Brooks Locklear, we've been talking about COVID for 18 months now. Mm-hmm. We initially began talking about social distancing and the 3 W's before the vaccine became available. And for the longest, I guess, since it's almost a year now, I'd say, we've been talking about getting vaccinated. Mm-hmm. And we're still struggling to get our people vaccinated here in Robeson County. And American Indians are at the lowest vaccination rate in Robeson County and the surrounding area in our tribal territory, which is a 4-county area. And we also had the highest positivity rate. Mm-hmm. So I thought it was prudent for us to visit again, and you bring us up to date on what more can we do to get our people vaccinated.
Yeah, there seems to be still a lot of questions out about the vaccine. I guess with the new mRNA technology, people just have a lot of questions still, and I think educating and counseling over and over again is the best way to try to improve our vaccine rates.
And what is mRNA?
So mRNA technology, which is a messenger RNA, is like a genetic tool that's been around for decades. So scientists have been
Decades.
So scientists have been researching mRNA since the 1980s in labs, and then they started doing animal studies in 1990s. Mm-hmm. So for decades. So some scientists have spent their whole entire life, their whole career for decades, researching mRNA, looking at all its properties, what its potential uses would be in the future, how to stabilize it, to make vaccines for the future, for instance, or medicines for the future. So there are scientists that have spent years into this. So there were certain scientists in certain labs that were already researching specifically how to even make other coronavirus vaccines before we had a pandemic, right? And so when the pandemic occurred, with mRNA, as soon as you know the sequence of that virus, the coronavirus, you can very quickly design an mRNA targeted vaccine. Mm-hmm. So these scientists that are very, very well versed and experts in mRNA could quickly make this mRNA vaccine. And a lot of people would say, what is the mRNA? It's just very different because the usual vaccine has what we call an antigen, which is a part of what you're trying to do to protect your body, be it a virus or bacteria. You use a part of it being alive or dead to stimulate your immune system. But with mRNA, there is no antigen. There is no antigen, it's the mRNA. mRNA is a blueprint. It's like if you wanted to build a house or a building, a contractor looks at a blueprint to know how to design it. So mRNA is where your body takes in the mRNA, and it's like a decoding, a little encoder process that tells your body to make a certain part of the virus. With the Moderna and the Pfizer vaccines, the mRNA is encoding what we call the M spike protein, which is that famous red knob that you see on the coronavirus pictures that you see. So that mRNA goes into your body, your ribosomes in your body literally code that to make what we call that spike protein. Your body immediately recognizes it as a foreign body, and it mounts an immune response. So various things in your body make antibodies for this spike protein, but within a short period of time, the mRNA is degraded and the actual spike protein is degraded. They're gone in hours, but the antibodies last much longer to give yourself that immunity. So it may be new to the public, I guess, to non-scientists, but it's definitely not new in the scientific world and in the medicine world. We've known about this and its technology and its potential benefits for decades now. So scientists know a whole lot about it, and it's literally brilliant technology. It's super easy to make in a lab. It's groundbreaking, very quick to make in a lab.
So you answered one question I had. That there's been a lot of concern that I've heard from people that they made it too quickly, but in essence, it's been going on for decades.
So the reason why they can make it quickly is the technology has been around for a very long time. So when you have decades of technology,
had a big head start.
You have a huge head start, decades for such a time as this. It's like, to me, divine intervention. So you have scientists that are prepared for years. You have a new virus that's causing a worldwide pandemic. The Chinese were able to find the exact sequence of that virus. So once we know the sequence, we know the genetic sequence, right? We can design a specifically targeted mRNA for us to make that spike protein, and it was designed within hours, like hours, okay? So within 2 days, a scientist actually designed the mRNA vaccine. Now, it took about 2 more months to produce, to make in the lab, but that is groundbreaking. Don't get me wrong, that is new, that's earth-shattering, but it's because of years of research and because this is a completely different technology than all other prior technologies that allowed us to make it so quickly. It's actually a wow moment. It's a huge in science and medicine that we have an ability now to make new modern medicines and vaccines in such a quick process. Yeah. So we love the fact that we were able to make it so quickly. And I know it may cause skepticism, but it's done very safely. And then with the whole process of the trials, there was no method skipped in the actual safety of the trials and the different people, so the thousands of people that were trialed. There was no skipping the safety. What we did skip was the red tape, if you will.
Right.
So the bureaucracy and the getting things approved and the politics behind it, we skipped that process to make it shorter. But the essence of the mRNA allowed us to design it quickly, and then the vaccine trials took the same amount of time as any other vaccine trial, okay? We just cut the red tape.
Right.
So it seems like it's quick, but it's not in a bad way quick. It's not that it's an unsafe quick.
Well, what about the things that could have happened if it hadn't been developed as quickly as it was? How many more deaths would there have been without it?
Exactly.
If it had been a slow process to get the vaccine out to the people,
Exactly.
to the world.
Exactly.
And which is an ongoing process. The whole world hasn't been vaccinated yet. But we're just struggling here in America, and we're struggling here in Robeson County. I worry about our local area. That's what my concern is. I can't speak for the rest of America or the world, but I can speak about the local area and try to have some impact here like you're trying to do. Mm-hmm. But tell me, this mRNA, does it have, what kind of side effects, good or bad, long-term, short-term?
Okay. So we know that there are common side effects we should expect that are similar actually to any other vaccine. So the common ones are typically after the second shot of the Moderna or Pfizer, you can get a fever, chill, headache, or fatigue, one of those 4 symptoms. And we tell people to expect it because it's more than 50%. So you should expect to have a symptom like that, which is a sign that your immune system's working, the vaccine is working, you're making antibodies. That typically occurs 24 to 48 hours after the shot, but it's way more prevalent after the second shot. Most people only have arm pain after the first shot. So those are common, but those are not a reason to not get the vaccine. That's proof the vaccine is working. Those are common for any other type of vaccine on the market, okay? And as far as the rare things, there are some rare potential side effects. It's just all the science shows that the risk of a harm, the risk of a serious adverse effect of this vaccine is much lower than your risk of getting COVID and having an adverse effect of COVID, right? So there's rare things that you see with any other vaccine. There's a rare chance of a severe allergic reaction, but it's extremely rare. You're way more likely to have an allergic reaction to many common prescriptions or even over-the-counter medicines. There's a rare chance of Guillain-Barré, a weird paralysis of your body, which can be very serious and detrimental, but other vaccines cause this reaction, and COVID can cause this reaction as well, right? There's, for instance, something called myocarditis, which is like an inflammation of the muscle of the heart. Other vaccines can cause this. In Moderna and Pfizer, it's more common amongst males ages 13 to 30, so the young male, okay? It's way less common in the average population. But we also know COVID causes myocarditis at a much higher alarming rate. So even amongst college athletes, they have a 2 to 3% chance of developing myocarditis after a COVID infection, when it's way smaller than that after the vaccine. If you get myocarditis after the vaccine, we monitor you, but there's no signs of death or permanent heart damage from the myocarditis. It's something that resolves with time and monitoring. Mm-hmm. So those are rare. There's a rare chance that could happen. But if you're looking at statistical odds, the benefits way outweigh the potential risks. Your chance of getting COVID in Robeson County and dying of COVID and have a severe outcome of COVID is way higher than getting any serious adverse event from a vaccine.
Well, you know, I've never told people this, but I have a tattoo. Mm-hmm. And most people my age have this same tattoo, and it's a booster shot tattoo. So anybody in my age group has a round
Yep.
mark
My mom has
on your
from the
left
vaccine.
from being vaccinated when we were
Years ago.
children. You had to vaccinate and achieve that tattoo, that vaccine tattoo, to be able to go to school.
Yeah.
And even with the COVID, you don't get a tattoo. You get
Yes.
the shot, but it doesn't leave any marks.
Exactly.
So that's one change from 60 years ago.
Yeah.